Good evening, everyone. This is Meldita and I'm back. So welcome to my YouTube channel, Meldita's Info Corner. My Facebook is johnrigacho@yahoo.ca. Okay, reperfusion or reperfusion injury after stent insertion or PCI. PCI means percutaneous coronary intervention. Okay, let's talk about reperfusion of early STEMI. So we have a case here of a male patient complaining of severe chest pain, feeling dizzy to the wife. So the wife called 911 and the advanced life support crew arrived. They hooked the patient to their monitor and we have an ST elevation in lead 2, 3, and F. So indeed we have an inferior STEMI. So they give chewable aspirin, 320 milligrams, unless the patient took already some, and they will just give the top up. And then the ALS crew will alert the hospital's cath lab that there's a STEMI patient coming. Okay? In the cath lab, the interventionalist did an angiogram. So he found out that there is a blocked right coronary artery. Okay, here we go. And he put a stent. Okay, here we go. So the blocked coronary artery or the epicardial artery is dealt with. So stent inserted. Okay, the artery is opened. Okay, and we have now a good epicardial blood flow, followed by a good distal blood flow. Okay, and we have a flow of TIMI FLOW 3, which is normal. And then with good blood flow, we have also a good flow of blood going to our acute ischemic cardiac tissue. So we have a successful reperfusion and the patient will no longer complain of chest pain. And when the patient arrives in CCU, we do ECG and we will see that there is an ST elevation that is coming down, but it will never go right away to isoelectric. It usually takes like about 12 hours for the isoelectric line. Okay, and if you go higher, the STEMI is in the inferior leads here. Okay, so previously, STs are more pronounced here, 2, 3F. And in here, after the stent is inserted, you notice that the ST elevations, they start going down from 2.5 small square to 3. We have like 2.5. So we have like probably 1 to 1.5 elevation here. So the elevations started to go down, which is good. Okay, after the artery is opened up. Okay, so that is a successful PCI to the right coronary artery. And with this successful reperfusion, our STEMI evolution will be shorter and the recovery of our affected heart's anatomy and function will be faster. Okay. So when we say there is a reperfusion that is successful, it's because we open up the right coronary artery, we have a good epicardial blood flow, followed by a good distal blood flow to the smaller arteries because we have also a TIMI FLOW 3, and then a good blood flow now going to our acute ischemic cardiac tissue. So that was a success. So the doctor uses this TIMI FLOW scoring system, which is the normal is 3. So TIMI is named after the thrombolysis in myocardial infarction. This is a scoring system of the contrast dye going to the coronary arteries. Okay, so what happened in the cath lab is that they will inject a contrast dye to the coronary arteries. So during injection time, they will see this blood mixed with the dye on screen, on the X-ray screen. Okay, and they will determine if there's a blockage or not of the coronaries. Okay, so when we speak of TIMI FLOW 0, the contrast dye is injected. It will not go through because the artery is 100% blocked. So that is TIMI FLOW 0. TIMI FLOW 1, the contrast dye is injected. The dye passes the blockage, but there's no distal perfusion. So again, 0 and 1, they're not good. So TIMI FLOW 2, the contrast dye is injected. It passes the blockage, but with slow distal perfusion. It's still not good. Then TIMI FLOW 3, the contrast dye is injected. It will go in spontaneously because the artery is open. There's no blockage and there's a good or normal distal perfusion. So TIMI FLOW 0 to 2 is abnormal and that's not good. There's not good perfusion. They're not good at all. And then TIMI 3 is normal. So there's a good distal perfusion. So 0 and 2 is abnormal, not good. And then TIMI FLOW 3 is good. There's a good distal perfusion. Okay, so successful reperfusion because artery is open, There's a good epicardial flow. There's a good distal flow to the smaller arteries. TIMI flow 3. And there's now a good flow to our acute ischemic cardiac tissue. The patient will no longer complain of chest pain. The ST elevation starts coming down in CCU. And then the reperfusion arrhythmias, example, the common one is the accelerated idioventricular rhythm and PVCs. They start occurring in less than 3 hours. So then our STEMI evolution will be shorter. And again, as I said, recovery will be faster with regards to the affected heart anatomy and function. Okay, there we go. Thank you.